Hey, fellow cat lovers. We all adore our feline friends and want nothing more than for them to be healthy and happy. But here's the tricky part. Cats can't tell us when they're in pain or feeling unwell. So how do we figure it out? Well, it's up to us to tune into their subtle signals and understand when something might be wrong. Don't worry if you're unsure what to look for, because we got you covered. In today's video, 20 alarming signs your cat is extremely crying for help. us.That. We will dive into the crucial signs that indicate your cat needs immediate attention. You'll learn about the behaviors and symptoms that can signal a problem, helping you to take swift action and ensure your kitty gets the care they desperately need. Without further ado, let's jump into the first vital sign. Number 20, steering clear of the litter box. Imagine coming home to discover your cat has been going to the bathroom in random spots around the house instead of their litter box. Frustrating, right? But don't be too quick to blame them. If your feline friend has always been diligent about using their litter box and suddenly starts avoiding it, this could be an urgent cry for help. Health issues like urinary tract infections, kidney disease, or even bladder stones might be the culprits behind these troubling behaviors. These medical conditions can cause pain and discomfort, making it difficult for your cat to stick to their usual bathroom routine. It's crucial to take these signs seriously and consult with a vet to ensure your cat gets the care they need. Remember, a sudden change in litter box habits is often more than just a minor inconvenience. It's a flashing red alert that your cat might be in distress. Number 19, bad breath. If you've noticed that your cat's breath has an unusually foul odor, don't ignore it. Bad breath in cats can be a warning sign of underlying health issues such as gum disease or tooth decay. These problems are more common than you might think, and they can cause a lot of pain and discomfort for your feline friend. Cats' mouths naturally harbor a variety of bacteria, which can accumulate and lead to dental problems over time. To keep your cat healthy and happy, it's crucial to take preventative measures. Brushing your cat's teeth regularly can significantly reduce the risk of dental diseases, and scheduling a professional dental cleaning at least once a year is essential. Not only will these steps improve your cat's breath, but they will also ensure better overall health and well-being. Yeah, so if your cat's breath is making you wince, it might just be their way of crying out for help. Pay attention to this alarming sign and take action to protect your furry companion's dental health. Number 18, changes in grooming habits. Cats are meticulous groomers and typically spend a good portion of their day cleaning themselves. If you notice your feline friend suddenly neglecting their usual grooming routines, it's a red flag that should not be ignored. This could be a sign of a variety of underlying health issues ranging from dental problems, obesity, or arthritis to even more serious ailments causing your cat to feel unwell and lethargic. When a cat stops grooming, their coat may appear messy and ungroomed. You might notice matted fur, bald spots, or dandruff. Their ears might become dirty, and you could find excrement clinging to their hind end or debris trapped in their fur. A well-groomed coat is a sign of a healthy and happy cat. So if your kitty is looking disheveled, it's time for a vet visit to get to the bottom of the issue. Don't dismiss this behavior change. It's your cat's way of crying out for help. Number 17, crying or yowling. If your cat is crying or yowling frequently, it could be an alarming sign that they are in significant discomfort or pain. Pay close attention to this behavior, especially if it is out of the ordinary for Try gently petting them, and if they whine, pull away, or seem to avoid your touch, it's a strong indicator that something might be wrong. Cats are masters at hiding pain, so vocalizations like crying or yowling are their way of asking for help. Don't ignore this cry for help. It's crucial to consult your veterinarian to determine the underlying issue and provide the necessary treatment. Number 16, too increased aggression. Have you noticed your usually sweet and gentle feline friend suddenly acting out with unusual aggression? This sudden shift in behavior can be a significant red flag indicating that your cat is desperately crying for help. Often, when a cat is in pain or not feeling well, they might become irritable and lash out. Especially if you inadvertently touch a sensitive or sore area, it's their way of saying something's wrong when they can't vocalize it. If your cat is hissing, biting, or swatting more than usual, it's crucial to pay attention to these cues. This change might not just be a behavioral quirk, but a sign of underlying health issues that need immediate attention. Don't ignore these aggressive outbursts. Your cat might be in distress and require a visit to the vet to ensure they're not suffering in silence. Number 15, unexpected weight changes. This is one sign that might seem easy to overlook, but it's crucial to pay attention to your furry friend's weight. Imagine this. If your cat suddenly gains or loses even 1 pound, it's similar to a human gaining or losing 10 pounds in a short period. That's quite a drastic change. The bodies of our feline friends work much differently from ours, making even small weight fluctuations a significant red flag. So if you notice your cat looking a bit plumper or skinnier without any obvious cause, it's essential to take action and consult your vet immediately. This isn't just about aesthetics. It could be a serious health concern. For older cats, some gradual weight loss might be a part of aging as they naturally lose muscle mass. However, Any substantial changes could indicate underlying health issues, such as diabetes, thyroid problems, or even cancer. Don't ignore these subtle hints your cat might be giving you. They're their way of crying out for help, and timely intervention could make all the difference in their well-being. Number 14, signs of mobility issues. Is your cat moving less fluidly or showing signs of stiffness? Watch closely for limping or difficulty in jumping, which can be particularly worrying if your feline friend is still young. This could indicate an injury or underlying health problem that needs immediate attention. For our senior cats, these signs might point to arthritis, a common issue that significantly affects their quality of life. Observing and addressing mobility problems can save your furry companion from unnecessary pain and ensure they remain comfortable and active. So keep an eye on how they move. It's more important than you might think. Number 13, coughing. Cats, much like humans, can experience bouts of coughing for numerous reasons. While it might simply be a benign reaction to allergies, pesky hairballs, or even asthma, it's crucial to delve deeper. Persistent coughing might be your feline friend's way of signaling something more sinister, such as heart or lung disease, respiratory infections, or chronic bronchitis. Imagine the discomfort they're feeling. Prolonged coughing exceeding a day is a red flag you shouldn't ignore. Instead of brushing it off, take immediate action and consult your veterinarian. It's always better to be safe and ensure your cat isn't suffering from a hidden condition. Number 12, blood in urine, stool, or vomit. Spotting blood in your cat's urine, stool, or vomit can be a frightening and alarming experience. Imagine you're just going about your day when you notice these signs. This is not just a minor issue. It could be your cat's way of signaling that something is seriously wrong. Blood in your cat's urine often points to a urinary tract disorder, which could lead to severe complications if left untreated. Finding blood in their stool isn't any less troubling, as it could be indicative of several illnesses ranging from parasitic infections to more severe conditions affecting the gastrointestinal system. When it comes to blood and vomit, this is an emergency red flag you cannot ignore. This symptom often signifies a critical problem needing immediate veterinary intervention. Remember, when you spot any of these signs, it's not just unsettling for you, but potentially life-threatening for your furry friend. A quick trip to the vet can make all the difference in ensuring your cat's well-being. Number 11, an unusual lump or growth. Imagine discovering a bump or growth on your beloved cat. It's a moment that can spark concern instantly because it's difficult to determine if it's something harmless or a potential health risk. A visit to the vet is the only way to get a proper diagnosis. Even if the newfound growth turns out to be benign, it could be situated in a place that causes significant discomfort for your furry friend. Cats are instinctively drawn to routines and comfort in their daily lives. Hence, any source of physical discomfort, such as an abnormal growth, can disrupt their well-being and prompt signs of distress. Pay close attention to any changes and consult your vet to ensure your cat remains happy and healthy. Number 10, hiding more often. Have you noticed your feline friend hiding away more frequently than usual? While cats do enjoy some alone time to relax and recharge, an increase in hiding behavior can be a clear indication that something is amiss. Your once social and playful kitty is now often found tucked away under the bed or behind the couch. This sudden change could be your cat's subtle cry for help. When cats start to hide more than normal, it might mean they're in pain, possibly due to a physical injury, in an underlying health condition, or the onset of arthritis. Additionally, elevated stress levels could cause your cat to retreat into hiding. Changes in the household, new pets, or even a minor shift in their routine can elevate stress and cause your cat to seek solace in solitude. It's vital to pay attention to these fluctuations in your cat's behavior. If you observe this sign, don't shrug it off. Make sure to consult with your veterinarian to eliminate any hidden illnesses and ensure your kitty gets the comfort and care it needs. Number 9, discolored gums. Healthy gums are a cornerstone of your cat's overall health, and normally they should be a vibrant, deep pink color. You can check this by gently pressing on their gums with your finger. If everything's working as it should, the spot you pressed on will turn pale momentarily, but bounce back to that healthy pink within a few seconds. But what if it doesn't? If the pink color of their gums doesn't return quickly, this could be a major red flag. This sluggish response might indicate that your cat is experiencing blood loss or poor circulation, both of which require immediate attention. The pink hue of gums comes from the blood flowing just beneath the surface. If you notice their gums have turned blue or have a bluish tint, it's a sign that your cat might not be getting enough oxygen, an issue that needs urgent vet care. On the other hand, bright red gums could signal problems like toxicity or overheating, which are serious in their own right. And if the redness is localized right at the gum line above the teeth, it's often a sign of dental issues such as gum disease. So always keep an eye on your cat's gums as part of their regular health check. Any change in their color can be a distress signal that your feline friend is in urgent need of help. Number 8, excessive drinking. Have you ever noticed your cat suddenly gulping down much more water than usual? While it might seem harmless at first, this can actually be a significant red flag. Typically, cats don't drink vast amounts of water, so an empty water bowl can be quite telling. If your kitty starts exhibiting an unquenchable thirst, it could be an indicator of underlying health problems such as diabetes or thyroid issues. Both these conditions affect hormone levels and can lead to increased water consumption. Additionally, excessive drinking might signal potential kidney issues. Kidney problems are often associated with older cats, but can strike at any age. So it's critical to keep an eye on your cat's drinking habits and consult your vet if you notice any drastic changes. Remember, our feline friends might be silently crying for help, and it's up to us to listen and act promptly. Number 7, increase in eating habits. Most pet owners immediately become concerned when their beloved cat stops eating. But did you know the opposite scenario can be just as alarming? If your feline friend starts devouring food voraciously, all of a sudden it's a red flag that shouldn't be ignored. This unexpected surge in appetite could be a sign of underlying health issues that require prompt veterinary attention. Conditions like diabetes, hyperthyroidism, or even gastrointestinal problems that affect nutrient absorption might be driving your cat to eat excessively. While it might be easy to brush off the behavior as mere greediness or a newfound love for their kibble, the truth can be much more concerning. If you notice your cat raiding their food bowl more often than usual, scheduling a checkup with your vet could be a critical step in safeguarding their health. Number 6, vomiting. A common misconception among cat owners is that frequent vomiting is normal, with some believing that it's fine for their feline friend to throw up once a week. This couldn't be farther from the truth. While it's not unusual for a cat to vomit a few times a year or occasionally cough up a hairball, consistent weekly vomiting is a red flag. Such frequent episodes of vomiting can indicate that your beloved pet is suffering from an underlying health issue that requires immediate attention. It's important to pay attention to the frequency and circumstances of your cat's vomiting. If you notice your cat throwing up regularly, it's crucial to consult your veterinarian to determine the cause and provide your pet with the care it needs. Remember, your cat's well-being is paramount, and addressing these alarming signs promptly can make a significant difference in their health and happiness. Number 5, excessive hair loss and crusty skin. If you notice your cat shedding more than usual and developing scaly red patches on their skin, it's time to act quickly. This could point to underlying skin diseases, vitamin deficiencies, allergies, or could be a sign of severe stress. In some cases, these symptoms might indicate ringworm, a condition that needs urgent veterinary attention. Don't delay. Ensuring your feline friend gets a checkup could make a world of difference to their health and comfort. Number 4, as in loss of appetite. Has your cat suddenly turned its nose up at its favorite treats? Don't brush it off just yet. This abrupt change in eating habits could be your cat's way of signaling that something is seriously wrong. From infections and kidney issues to fevers and even cancer, a sudden loss of appetite demands your immediate attention. Always keep a close watch on your feline friend's eating behavior to catch potential health issues early. 3, noticeable shifts in sleeping patterns. If your cat suddenly starts sleeping the entire day when they used to be quite active, this might be a red flag that something's amiss. Cats are creatures of habit, so a drastic change in their sleep routine could indicate an underlying issue. Conversely, if your feline friend becomes unusually active during the night or starts being excessively vocal during the day, these could be cries for help signaling discomfort or distress. Stay tuned to their sleep habits. It's often one of the most telling indicators when they're not feeling their best. Number 2, watery eyes and sneezing. It's alarming when your feline friend starts exhibiting symptoms like watery eyes and constant sneezing. These can be telltale signs of an upper respiratory tract illness, quite similar to the common cold in humans. If your cat's eyes are excessively runny or you notice a clear discharge, it could indicate discomfort in their eyes or even a blocked tear duct. Be on the lookout for green or yellow discharge, as this usually points to an infection that requires immediate veterinary attention. Additionally, red and runny eyes might suggest conjunctivitis, often brought on by dust allergies, infections, or other allergens causing pink eye in cats. To make matters worse, feline herpes can exacerbate this condition. Keep a close eye on these symptoms and seek professional help to ensure your kitty stays healthy and happy. 1, trouble using the litter box. If your cat is making frequent trips to the litter box but seems unable to relieve themselves, it could signal a serious problem. This behavior might indicate a blockage, which can become life-threatening if not treated promptly. You might also notice your kitty showing signs of pain or discomfort while trying to go. Don't ignore these signs. They need urgent medical attention to avoid severe health complications.